John Melcher, I make a motion to open the meeting of July 6th at 7:03.
I'll second that. Susan Elwell.
Great.
All those in favor?
Aye.
Aye.
And present are
Susan Elwell.
John Melcher.
Charlie Costello.
Frank Marcagnani.
All right, so let's just take the agenda from the top.
Yes.
So we've got a quick report on our septic loan program
Yeah.
for the quarterly report.
Yep. In your packet, you'll see it in there. It was a quiet quarter. There was actually no activity this past quarter.
Yeah.
So we started off with the 436, 535.81. That was the total from last quarter ending in March. There were no additional drawdowns. We actually drew down all the money that we borrowed. The $1,250,000 has all been drawn down now. And again, there were no disbursements this quarter, which leaves us with the ending balance of $436,535.81. We do have quite a few applications out right now. There's about 3 or 4 that are circulating right now that will be coming back most likely before the end of the next quarter. So see how that goes. And we're just basically getting ready to forward these to the treasurer and the county for verification and submit them to DEP.
Okay.
Any questions on the quarterly?
Nope.
No.
There are a lot of houses for sale in Raleigh. I'm sure that's a
Yes,
factor.
there are.
Yeah, there's, yep. They are.
Okay, so next up is the annual report.
Yep. This is our annual report for the fiscal year ending June 30th of 2015.
And this is the report that has to go to the DEP,
Yes, this one goes there as
the
well.
people that give us the money.
Exactly, yeah. This time of year, we send both over at this time. Usually, as you know, every quarter we send that one over, and this year we'll add this one on to it as well. And you have a copy of that as well. You can see the balance from last year was $1,514,565.96. There were, again, no drawdowns this past year. We drew all, like I said before, the $1,250,000. The next item is the collections from the regular tax billings, which was a total of $59,502.70. And you can see how it's broken down from principal and interest there. The principal being $46,103.14, and the interest $13,399.56, which brings you back to that total. Next category is the collections, which totaled $58,000.
So these are people that paid off their loan,
Exactly, yep.
okay?
The total of the lump sum collections was $58,356.43. As you can see in there were 3 people that paid. They sold their house. They paid us back in full. One of them you'll see in there for $8,000. That was actually a partial loan, which is, as you know, with this program, you don't have to borrow the entire amount for the system. You can borrow as much or as little as you want. So that was a good example of how someone just wanted.
But when they borrow the money, there's a lien on their property.
Yeah, it's a real betterment, but yes, it gets recorded at the registry,
Okay.
and yeah, and
And then it gets unrecorded.
exactly, yes. When they do sell the house, I get a report from the treasurer saying they paid in full, and I'm unrecorded from the registry. Exactly. And in addition to those 3 houses that were sold, you can see there were 1 resident that paid additional payments to the principal, and you can see how we made 4 additional principal payments to help pay off the loan. So, which brings us to the payments to the trust, which was the $53,439 that we did approved at town meeting. You can see the breakdown. We do it twice a year in July and in January. Now this amount does not include the last $200,000 that we drew down. That'll be on next year's, which will raise it up $10,000, so it'll be $63,439. But again, that's not included this year, but will be in next year's. Which leads us to our ending balance of $1,578,986.09. And again, we're gonna, well, the treasurer already approved this, but this will forward this to accounting and also send it off to DEP. And that'll be it for this fiscal year. Any questions on the annual report?
Nope,
Okay.
all set, things are going along.
Yep, we really don't feel any need to borrow any more money right now.
No.
We're managing what we have and.
Also, we built up a little
We did.
fund of our own through
Yes.
this program. So, in the future, we might not need to fund it through the state and just fund it ourselves.
Right. And, you know, as people sell their homes or pay off their loans, all that money's coming back in, as you can see here, with the $58,000. So
Mhm.
that gets put back in the pot to lend out to
Great.
other people. So, like I said, we'll just continue to management. If it looks like we may need to borrow more, we'll let you know, but I don't
Mhm.
see anything in the near future that we would need to.
Okay, next item
All right.
is appointment of the health nurse for the next year.
Yep. As you know, Mary Ellen Mall is retiring. She's a COA director and our public health nurse, which is bad news for the COA, but the good news for us is that she's agreed to stay on as our public health nurse,
Wonderful.
which is good. It's good for her too. It keeps her active and also keeps her license active. So, and she did want to stay involved and is happy doing it. So, the monies have been approved at town meeting last year, so nothing really is going to change there. The
Good.
$2,000 is approved and ready to go.
Has
Basically,
she indicated how many more years she might like to continue, or do
No.
we have any
not yet.
inkling
No.
as to what that would be?
No, I think it's. Let's see how she does year to year, but no, she didn't really say. She,
Okay.
for now, I guess we can go year by year and see how.
Yeah,
Or
but then
she-
again, we do have to plan
Right.
budget-wise
Mhm.
future years. So,
Right.
anyway, we certainly appreciate her work and her services, and
Right.
glad she's gonna continue,
Mhm.
hopefully for a long time.
Yeah, we can talk to her and say, you know, if you think that you're going to be
Yeah,
not wanting to
She
do
will, I
this.
think. She understands how important it
Yeah.
is to get somebody in there
Right. She
in a
knows how.
timely way.
Yeah, and it's going to be.
yeah, 'cause Susan needs a health nurse right now.
Exactly. It's very moment.
I should wish she was here. I'll say, so our next item is,
Just
Oh.
one more thing. I don't know if the board, you know, now that we're going to have Mary Ellen in this specific role, if you had any thoughts of how you'd like, if you want to have like, you know, office hours for her during the week, or is that something you want us to work out with her and the new COA director? You know, right now where she's down the hall, we use her on an as-needed basis. We really don't have a set
Right.
schedule, you know, or office hours for her, but.
we should put that on our next agenda
Okay.
to discuss the schedule with this new nurse position, where she's just working as the nurse.
Right.
And when does the new the new COA person come on?
I'm just not sure if they're
Do
done.
they have one?
No, not yet. I haven't heard anything
So
yet.
they're
It has been
interviewing?
posted, yeah, they're interviewing it. It has been posted, I don't know how far they've got along yet.
Well, where there's shared responsibilities,
Right.
because she's done both jobs and it's kind of wedded both departments, we should wait till the new director is on board to see
Yeah.
what types of services she might want,
Right.
and then we can make a formal
Yeah,
job description.
exactly.
With no major changes, I mean, always in the best interest of all citizens of Rowley and the Council on Aging.
Right.
But it's been a dual job, we're down the hall,
Right.
so it makes sense to have it.
We need to
Together.
have a place because
Yeah.
sometimes she'll go into her private office and
Right.
call about some health problem that someone has. And they called back to her at the Board of Health office, and there is no privacy in there.
Well, our,
And we have
our
to watch
offices,
that.
our offices are weak
Yeah.
as far as privacy is concerned.
Awful. Yeah.
And do you have a separate line upstairs?
We do, yeah.
She could,
We were gonna,
So we'll have to definitely
yeah.
make a position for her there.
Because she's gonna lose the office here, so we're
Yep.
gonna have to
Right.
find a home for
Yep.
her. We were thinking of using some grant money to buy a laptop for her. That'll be the health nurse's computer. If she were to leave, that would, someone else would have this computer, and we can try to set her up somewhere.
Yeah,
And
I
and she
think,
can also bring that to the COA if she works something with the director where she might want to have hours there.
I-
sometime.
it's just that she needs to have a private
Right.
space to speak on the phone about something.
Exactly.
I think that, as I said before, this should be an item at our next meeting,
Okay.
and you should connect the dots.
Okay. Sure.
So, how about our upcoming flu season?
Yes. Would the board like to officially appoint Mary Ellen as our public health nurse for FY16?
We normally do that every year?
Well, town administrator advised,
Oh.
suggested you formally voted,
Well,
because.
I would,
Someone
I would
make a
move
motion?
that we accept Mary Ellen Mile as our public health nurse with gratitude for her previous service to us.
for fiscal year 2016.
2016.
Second,
All those in favor?
I,
Aye.
And like you said, we'll be working with the new COA director to see,
Yep.
how we can all easily, smoothly transition this and continue to have the nurse and the director work together.
Flu season.
Okay. Well, actually, Mary Ellen's retirement actually comes at a good time because now we're going to talk about flu clinics as early as it is. As you know, the state over the last few years has been talking about reducing the amount of flu vaccine that the towns will be getting because everyone is required to have health insurance now. So the state was giving us the flu vaccine mainly to reach people that don't have insurance. But now it's, over the last couple of years, they've been telling us that this is gonna be going away and that you're gonna have to use your insurance to get your flu shot. So it's finally here. We normally get 210 doses every year. This year we could petition to get a few doses, so I did request 10 for any uninsured residents that may come across. And it was just no guarantee that you were going to get those. And I'm happy to say we did get approved for the 10 doses, so we will be getting those for anyone that may be uninsured. However, we need to think about how we want to go forward as far as the flu clinics and distributing the flu vaccine goes. Basically you can either say, tell the residents, well, you need to either go to your doctor or to a pharmacy to get your flu shot, or we can continue to have them here, but have someone come in and basically run the clinics, do the paperwork, and we just would supply the building. We have, in your packet, you'll see a couple of emails and proposals from Rite Aid over in Ipswich contacted us a few times, inquiring about if we were interested in having them help us with the clinics. I basically left with them that the board hasn't even talked about this yet, but we will mention it at our next meeting to see what direction they want to go, whether they wanted to continue to have clinics here at the town hall and have an outside source, run them. There are some advantages. Before, we only had a couple hundred doses. This would be an unlimited supply of vaccine, and we could serve any age group. We don't have to prioritize anymore. The board doesn't have to. The state used to give us standing orders on the order in which the vaccine is to be distributed, whether it be uninsured people, elderly, people that had comprised a low immune system. So this is actually not a bad thing if the board wants to go in this direction.
What about liability?
Yeah, that's what I'm going to need to talk to the town administrator about.
Well, we need to know that before we decide on it.
Right. I didn't know if the board wanted to go this route or not. If they did, then we can start asking those questions.
I think when that question's answered,
Okay. You can make a
and
decision.
it should be answered by our next meeting,
Yep. can do that.
then we could act.
Okay.
Because it sounds like, I mean, the fact that it would be very similar to what has been going on.
Right.
Raleigh residents could come here,
Right.
all Raleigh residents could come here, and they know where to go, and there's no extra charge.
Right.
And Rite Aid will handle the billing
Mhm.
with the insurance people.
Mhm.
What do you think?
Has the turnout dropped? I mean,
No, we usually have one major clinic, which brings in about 80 to 90 people usually. And at that point, after that major clinic, we look at how much we have left and then go from there. But with this, you could have as many or as few clinics as you want. You could have night clinics, you have day clinics.
And these people would be open to a schedule like that?
They would, yeah, you could work with them. There's actually two things they propose. The proposal that's in your pack is actually
It's for
for
employees.
employees, right. So if you wanted to, you could set something up for just the employees of the town
Right.
and do other clinics for residents or anyone else, or you could just have employees come to the.
but the town employees already have insurance.
They do, yeah, they would just bring their insurance card. That's really the only thing that would change, is people would now need to bring their insurance card with them, and they would process the paperwork. And you know, we'd have different nurses here and so on, but nothing would really change.
Well, I think you should clarify the issue with the town
Yeah,
administrator.
okay,
And
Talk
put it
about-
on our agenda for
okay,
our August meeting,
okay.
don't you?
Yeah.
Yep.
'Cause if there are people like me that are allergic to albumin, you gotta watch them after they have a shot.
Right.
I don't have one because I have a really bad allergic reaction to it.
Yeah, you never get flu shot.
No.
Would you, we did reach out to Raleigh Pharmacy to see if they,
Was he interested, or they interested?
they are interested, but they are not set up to do this right now, but they said in the future they will be,
Okay,
possibly, so we'll keep in touch with them.
so,
Okay.
so
Yeah.
firm up what the town's issue is with liability
Mhm.
and that legality.
Mhm.
And maybe we'll have this on our agenda for August, and we would consider making a plan for 2016.
Okay. Would you like Rite Aid to come in and talk to the board about
Well,
what they would, we didn't get a lot of details yet because we weren't sure which direction you wanted to go, but if you wanted them to come in and talk to you, they could explain the whole program.
And we also have CVS here in town.
Right, and that's the other thing, we didn't know if you wanted us to reach out to CVS. Well, surprisingly, we haven't heard anything from CVS,
well, I think you ought to,
but we can reach out to them.
Reach out to them.
Yeah.
Yeah.
Okay.
why don't you reach out to CVS, see if they're interested,
Okay.
and then for our meeting in September, we could have evaluated both, if there are two, and make a decision.
Okay. Okay.
And maybe ask Rite Aid for more details.
Yeah, we can do that. Okay. Yeah, as you can see in one of the emails that the wellness ambassador from Rite Aid sent us, you know, they talk about no travel fees, no setup fees, no marketing fees. They'll basically do all the advertising. All we have to do is basically open the door and let them in. They'll process all the paperwork with the insurance, which is a lot of paper. So anyway, okay, we'll do that. We'll reach out to CVS and
All right.
see if they're interested and
Next item,
go from there.
the former former Girl Scout property.
Just, if I may, just one more thing on the, if we were to build this relationship with one of these pharmacies, you know, this could, when the new COA director comes on board, you could also talk about, you know, shingles, vaccinations, things like that, that the health nurse could work with the COA director and work with
Yeah.
this farm, you know, but it depends, if they want to do something like that, or just leave it to the doctors, but, because they do offer other services as well, for different types of vaccinations, so, anyway, there's a lot to think about there, but. All right. That's that. Okay, Girl Scout, property owner member to that. is now the former Girl Scout property. I'm gonna get used to saying that.
It was fun.
Did you bike once?
We used to bike this a lot.
First,
What, the three-wheeler?
What's next?
So,
in your packet, there's a map of the property, the piece of the property that's being leased. I don't know how familiar
not at
you
all.
are. Okay, so you want me to give you a little overview of the whole
Please.
property and
Yeah.
what I thought we
And this
could-
would be a good opportunity when we get set up with this laptop projection capability so that we could project this map
Mhm.
up there.
Right there, yep. I thought we could go through each of the areas that we're involved in, and I can go
Sure.
through each one. But I'll start with the basic overview of the property. I think you all have this map here
Yep.
with you, okay? As you can see, about 7 buildings there. You can see Weathersfield Street and where the main entrance is. That's the main entrance where you come in. Right in the center there is the caretaker house. That's a 3-bedroom home. The caretaker that was working for the Girl Scouts is now working for the YMCA. So that was a very good transition there. He's very good, he knows the property, he takes very good care of it. It's been a great resource of where things are and what's been done there in the past. So he's going to continue in that role and remain in the house, but again, he's just being employed by the YMCA now. Below the caretaker's house, you can see those 3 buildings. There's a Vicor building, the Ranger Station, and Rocky Knoll Lodge. And then to the right of that is Brookside Lodge. Below that, you'll see where the pool is in the pool house. And there's another building, a Morton building. It's just a storage building. There's no water, no septic, just basically for storage.
What building is that? you're talking-
The Morton building
Right
down
here?
at the bottom. Yep.
Morton building. Oh, way over here, okay.
Yep. And above that, you'll see where the well house is for the well. That's right above there. You see where the basketball court is, the cook shelter, further up there, where the campsites are along with the Batchelder Brook. And you can see where the conservation land starts at the end of by the Morton building there, a little further down, is where that piece of conservation land, which you can see in full on the full map that you have there. They're working on renaming both of those parcels right now. The Selectmen and the Conservation Commission are working that out. The conservation land is about 173 acres, and the camp area is about 20 acres. That's that front portion where all the buildings are.
So on this other map, the conservation land would be where the Girl Scout land kind of narrows.
Yes, let me just grab that one. Okay. Yes, exactly, right here?
Yep.
Yep.
Where's the septic? Where's all the septic?
Yeah, I'm gonna get to that, yep, I can show you that. So anyway, that's just a little overview of the entire property. Any questions on the layout, or? And you can see where the roads are that sort of go to each of these buildings.
Is this land open to the public? And
Yep, I'm actually gonna get to that
All right,
as well.
okay.
But yes and no, and I can explain once we get down there. Any questions on the layout of where the buildings are, or anything there? Okay. All right. So, yeah, we can start with the septic. All right. The septic, all right. There are 4 systems there right now, possibly 5. We haven't got that far yet, but let me explain what we've done so far. And you'll see the drawings in your packet there as well. The first one has the caretaker House and Brookside Lodge on there. And you can see how they're fairly close together on the big map. Those two are on one system. And you can see how you have the map there where the two of them tie into that one septic tank. And then they go into the leaching field, which is 25 feet wide, 65 feet long. There's that one field. That one was inspected as one system and it passed, so there's no problem with that one. Any questions on?
Who did the inspection?
Dave
Clark?
Clark. Yep, they,
So, these have been inspected to meet Title V,
yes.
and how many of them?
There are 4, possibly 5, which I'll explain when I go along. This was one system on these two.
So they've inspected one system?
No, they inspected 4. One we haven't got to yet, and I'll explain why in a minute. But this one system has those two houses on it. Any questions on that one? No? Okay. The next one was the system for the pool house. You can see the pool house off to the side of the pool and the deck there. And again, you can see where it goes onto the septic tank and then into the field, which is 20 feet wide and 50 feet long. That's a separate system for that, and that also passed, no problem.
So the systems have been at rest for years.
They have, yeah. Well, about 2010, so yeah, it's about
Now,
4
pool
years.
house, does that just store chemicals, or does somebody live there? Or-
No one's living there. It just has the showers and toilets in there.
Showers.
Okay.
Yeah, no one's living there, no,
Okay.
no. And those were completely done over, repainted, new fixtures put in. It looks really.
Who was the tenant,
The YMCA, Switch YMCA in the North Shore.
or the North Shore YMCA, or are they all the same?
Well, I guess it's the Ipswich Y, but I guess they fall under the YMCA of the North Shore, I
Okay.
believe. But it's really the Ipswich YMCA.
And they've been cooperative with
Oh.
your dealings?
Oh, very well, very much so,
Excuse me.
yes. Yeah, but there've been actually no problems with communication or getting information, getting things up to where they need to be. No issues at all.
And is it working now? Are there campers there now?
Yeah, they started actually June 29th, and I'll
Okay.
get into that as well, also. So anyway, the pool house system, again, that's just for the pool house, and has a subsystem, and again, passed, no problems there. Any questions on that one? All right. Now, this is where it starts to get a little trickier. You see the third page of that form?
Mhm.
That has the Rocky Knoll Lodge and the Ranger Station.
Yeah.
Now, these two buildings are on one system as well. And the inspector felt the best way to do this was to do 2 separate reports, because even though they're on one system, he felt the need to do them separately, which we said that's fine. That's really his call. So these both were conditionally passed, and I'll explain why. On the Rocky Knoll Lodge building, do you see how it has its own tank there? He did indicate that there may be a leak in there, we're not sure. So what we're gonna need to do is water test that tank to see if there is a leak or not.
These are not tight tanks, are they?
No, these are connected to that field as well. So we're hoping that it doesn't have a leak. If it does, it will need to be replaced, but we are gonna do a,
When?
well, we did talk to the Y, and we're thinking right after the camping season, early fall. I mean, we could do it now if we really wanted to, but there's a lot of activities going on down there. They would accommodate if we really wanted to, but that's the main building that they're using as well. So they do have, Title V does allow for 2 years to get this done. So we thought maybe it'd be best to wait till after the camp season.
And they're committed they'll do it in the fall before
yeah.
next year's?
Oh, yeah, absolutely. And we're hoping that there's not a leak there, but we just have to find out.
Now,
for
these
sure.
names, Rocky, do people stay in that? Is that a lodge, or is that a?
No, this,
dining facility or
no, it's just a,
a
like
building?
a cabin, yeah.
This is all day camp.
Yes, all day camp, for now anyway. I mean, we don't know later on if they want to change that, but yeah, right now it's all day camp,
Okay.
no overnights.
How'd the other one do?
Yeah, the other one, well, this is where we're having a little bit of a problem. Do you see how it has, on the ranger station, it has the septic tank and then the pump chamber?
Yeah.
The septic tank is leaking at the mid-seam. So that is definitely gonna need to be replaced. And then right next to it is that pump chamber, which pumps into the leaching field. So that one's definitely gonna need to be addressed. So what we were thinking was to, instead of just replacing that tank, to replace both of them with a 2-compartment tank. Because the other one is probably gonna go at some point, and they're so close together, it's gonna be really difficult to work on just that one tank. So it would be a lot easier just to remove them both, put in a
There
2-compartment
can't be too
tank.
many gallons going through that.
No, there really isn't. Actually, that's really not being used at all right now.
Right.
So we were thinking of putting a 2-compartment tank in there, you know, with the 3 floats in it, and have all the wiring done properly. The wiring that's there right now is not up to code. It's gonna have to be done over. And with something in the ranger station, a panel on there, so that's what we're thinking there. And again, that's something that, there's no doubt that there is a leak there. So again, we're thinking of addressing that in the fall.
And the YMCA is in agreement that they pay for these upgrades?
That's part of the lease agreement, which the selectman's office handles. I'd have to,
But what's the answer then? Yes or no?
I
You don't know?
don't know. I can find out, but I don't have them.
Well, it'd be interesting to know
Right,
who's paying.
right. I can find that out.
Yeah, would you find
Yeah.
that out for our next?
Yeah.
Because these improvements probably should be done for next year.
Right. Yeah, that's what we're thinking in the off-season.
Well, they're renting the property for $1.
I don't know what the deal is. I
I
don't.
think that's what it is.
Yeah.
And can, you were gonna say something about if it's public, or could I go down there and bicycle through?
Yeah, I'm gonna get
Maybe
to-
not while the campers are there, but in September or something?
Yeah, I'm gonna get to the access.
Okay.
of the- Yep, that's on my list as well.
Good.
Just wanted to mention about one more thing before we get off of the septic. The Vicor building, you see that building to the
Yep.
left there, right on the radio station? That one there used to be their office building when the Girl Scouts were there. It's really, when you go inside, you'll see how it was really basically an office building.
Are there any cookies still there?
Not gonna look for those, unfortunately.
Is it gone,
gone.
Charlie?
So it was a long time. That building does need a lot of work. That's something that is definitely not gonna be done this year.
What's it used for now?
It's just vacant right now. No one's using it really for anything.
So it has its own system?
That's what we need to find out. The day that we were doing the Title V, there was some confusion on whether those 3 buildings were all connected to this system that we have up there that has the ranger station in Rocky Knolls. The caretaker there thought that they may be connected, like the Vicor building would pump up to the ranger station, which would then pump into the other system, but we don't know that for sure. So the inspector that day ran out of time, and so we left it that he would come back another time to do an inspection on the Vicor building to see where that goes, whether it has its own system or if it is connected to the ranger station. But we need to know that before we do anything else, because if it is connected to the ranger station, we need to appropriately size the tank for the ranger station to accommodate both buildings. And we also need to know what's going to be the use of that building, whether it's going to be continued to be an office building or if they're going to use it for another purpose, which we don't know yet. And the Y doesn't know yet either. They're sort of going step by step here, trying to address one building at a time. That's probably going to be the last building they're going to look at because it needs so much work. So we're going to have to...
Are these buildings all secure?
They are. Yep, they're all locked up. the caretaker overlooks it, and now that the Y is in there, they're, you know, securing them also as well. So we're gonna need to do more work on that FICOR building to see what's there, to see if it is connected, to see if it has its own system, to see if it passes or fails, and again, deal with whatever the result is. The inspectors have all the equipment, they have the cameras, they can send down there and find out exactly what's going on. So we're gonna have to reschedule that also. But right now, we just don't know.
What about the cook shelter? Is it just a lean-to with a grill in it or something?
Yeah, it just has a covering over it.
Oh, it's
no walls.
nothing.
It's open, yeah.
Right.
It's not being used this year. We're gonna have to take a closer look at that before. They are gonna wanna use it eventually, but not right now. They're so focusing on a couple of the buildings now just to get them up and running, and then they're gonna try to take each other one by one and try to address them.
And you've inspected the camp? and It's
Yeah.
all compliant with our...
Oh, yeah, I'm gonna actually
Okay.
get to that as well. Yeah. Any other questions on this subject?
No.
No? Okay. Yeah. And the full copies of the reports are here if you're interested and want to look at them.
I'll let John do that and report back to us next time.
Absolutely.
But that's basically a summary of that. So next we can talk about the water, if you like. As you know, there's two sources of water there. We have town water, we also have the well that's out there. Now, all the buildings that we just talked about are all on town water. There's a well out there that services the pool house, and all of the spigots that are throughout the camp area. The well is a public water supply. It was when the Girl Scouts were using it. Of course, they let it go, but now the good news here is that the caretaker who was working for the Girl Scouts is now working for the Y, and he does have the license needed to run this water supply, which is good. He has a VSS license, a very small system license that is up to date, and he's familiar with the startup and shutdown and everything that needs to be done with it, sampling and so forth. So that was actually a very smooth transition. He basically just is doing it under the Y versus the Girl Scouts. There are 12 service connections on that well, including the pool house and all the spigots throughout the tent areas in the field. The water was tested. It is fine. It never really had a problem with it. There was one time where they had one issue, but it had something to do with flushing of one of the hydrants that caused a little problem, but it was addressed immediately and there was really no other issue. But this was a few years ago. But it's back up and running now. Everything's running fine. So that should hopefully continue to run well. Any questions on the water? That's the only other public water supply we have in town other than the town of Raleigh's town water, so just so you know. So it looks like we will continue to have that one as well. That's true. Any questions on that?
But public is just specific to that property.
Right, oh, exactly, yeah. That just means that so many people are using it, so they have to follow different
Right.
testing standards, and so on. So, but yeah, just for the people on the property, yeah. And with the pool there, it'd be very difficult not to have a well there.
So the caretaker's house is lived in year-round,
Yes,
but that's on town water.
that's on town water, yes. The other buildings are just seasonal,
Yeah.
but the caretaker house is year-round, and all the buildings are on town water, except for the pool house. And it is a building, but it's, basically just showering and restrooms.
Mm-hmm.
Any questions on the water?
No.
Okay. Next, we can talk about the pool, if you like. We did issue the permit for the public swimming pool. Inspected it on June 25th. Everything looked fine. It's a junior-size Olympic swimming pool. I don't know if you've ever seen it. No? Okay.
Nope.
It's 35 feet by 75 feet, 2,625 square feet. It's 9 feet deep in the deep end. We did figure out the capacity. Basically, the pool has 1,400 square feet of swimmer area, which is over 5 feet. And the non-swimmer area, which is 5 feet or less, has 1,225 square feet. The swimmer area has a capacity of 70 people, and the non-swimming area has a capacity of 80 people, which gives them a total of 150 people.
At one time.
Yeah, I mean, that's including, you know, in the area, on the water, in the water. But basically the Y would never reach that amount. They basically run on 2 lifeguards, maybe 3. And they run on a ratio of 1 lifeguard per 30 swimmers. The state recommends 1 to 25, they run on 1 to 30. And I was talking to the director there, and she doesn't feel they would ever exceed 3 lifeguards. They would just ask people to come out of the pool. And that would be 90 people, which would be the max they would ever allow in
That's
there.
a big pool.
It is a big, yeah,
is a big pool.
it's a good sized pool. So, but again, they run it based on the lifeguard ratio, so
Yeah.
they would never meet that capacity. But on their occupancy permit, it does say 150, because that's what the math comes out to, according to the pool regulations.
Is it a chlorine pool?
It is, yeah. So that's the capacity, and that's their lifeguard ratio. Just to let you know some of the improvements that they have done already. There was a striping that was missing to separate the deep end and the shallow end. That was done. The edging of the steps was also marked, which wasn't done. They did update that. They also replaced the 2. They also have a chairlift there now, which is ADA compliant, which they didn't have before. But the new law went into effect, so they had to have something. It's a station. It's a chair that's going to be stationed there, and they ran it while I was there. Worked fine. It's going to be permanent, and it's based on how many people are going to be using the pool, the size of the pool. So they came up with this solution, and again, it does work fine. They put in a brand new filtration system. The other one was okay, but this is much better. They also put 2 new drain covers in the deep end of the pool, and these are VGB compliant, so no worries there. And we also have the certificate of compliance for those 2 covers.
What's VGB?
That's the Virginia Green Baker law that was passed a few years ago. There was a girl that had drowned in the pool. She got stuck at the bottom of the pool, and she couldn't get out of the water, and because she was being held down by the drain. Yeah.
Okay.
So they passed a law to have these covers put on there so that doesn't happen again. Unfortunately, it took someone to lose their life. But anyway, they have been replaced, and they are in compliance. So, and we do have that certificate on file. Their staff also has several certified pool operators and lifeguards that are fully trained and certified, above and beyond what they need. And also the pool water before the season started was also tested by BioMarine, just to ensure that it was fine. And everything was fine. It was tested on June 16th, and we have a copy of the report. So everything is fine there. There is a lot more work that needs to be done. A little bit of work on the deck, a little bit of work on the fence.
Yeah.
However, they just want to, right now they're on a 3-year lease, so they just want to make sure that they can renew their lease before they invest a lot more money into the pool. So, but I mean, nothing major, just some minor things that could be spruced up, but we talked about how to, get it so it's up to standard, but again, with the understanding that in the future, it'll be done a little bit better. That's about it with the pool. Any questions with the pool?
Are they gonna have a public swimming time at all?
Yeah, if you're a member of the Y, on
If
the
you're a
website,
member.
yeah, on the website, I didn't actually look recently, but they are gonna have posted public hours for people that are members that can go in there.
Oh, nice.
And they can have designated time for the campers as well, so
Yeah.
there is a schedule that you can look at and you can use. Yeah. Any other
Okay.
questions on the pool?
No.
Okay. But it looks really good. The clarity and the quality of the water is excellent. Over there, the the lifeguards and the operators went through the entire testing procedure. Everything was fine. Very knowledgeable. They have all the safety equipment in place that they need, all in good shape.
Good.
Again, looked really good. Next, we can talk about the summer camp there. The camp's also inspected on June 25th. We were out there. They're going to run from June 29th through September 7th, from 7 a.m. to 6 p.m. They already started, obviously. Right now, they're only using the Rocky Knoll Lodge and the Ranger Station. The Rocky Knoll Lodge is the best building there, and that's going to be their main building. That's a handout you can take a look at. I wish I had more copies, but I just have that one. But in there, you'll see all the listed programs that they have.
What's the range, the age range of kids going?
They should be right in there, I think. Is it on that first page?
It's not right now, but that's all right.
Yeah, it's basically geared towards young kids, school age. I
Yeah,
try to remember if they
K
said
to 8.
K to 8. Okay, there you go. They did have an open house there. I guess they had quite a few people come by. Over 200 people, I heard,
Nice.
on that
Really?
Saturday, June 20th. It's quite a few.
Exciting.
Yeah, there's quite a draw. They've got quite a few people come by and
You could walk down there and swim, wasn't you?
I know it.
Well, I could also,
Charlie can
For
walk
sure.
down
I
the
could have
back
a
hill
shorter,
and
I could have a
swim.
shorter walk.
Like I was saying, basically they're just going to use the Rocky Knoll Lodge and the Ranger Station. The Rocky Knoll Lodge is the best building, and they did a lot of, well, not a lot of work, but quite a bit of sprucing up in there to get it up to their standards. The Ranger Station does need a lot more work. They're just going to use the top portion of it for an art room. They have a garage door in there, so it's almost going to be like an open concept, because they're going to, if it's a rainy day, they can go in there and do art. And let's see, the building inspector's been out there and did give the occupancy permit for the Rocky Knoll Lodge and the Ranger Station. The Brookside building is not ready yet. They do want to use that building. That's probably the next best building there. There are a few things they have to address first, but that looks like it's going to be the next one that they're going to try to get up to snuff. We talked about the water supply. We reviewed all the plans and policies, which are numerous. The quarries and stores were all reviewed. All the plans were reviewed. The fire department signed off on the emergency plans and the fire evacuation plans. Fire, evacuation plans, drills, all that.
That's cute.
Let's see.
Joe.
The camp directors are all licensed, have all the certifications above and beyond what they need. They have no junior campers, no young kids. These are all adults. They prefer to have just adults. No volunteers, just employees. The aquatics director is very knowledgeable. We met with her when we were doing the pool inspection. Again, above and beyond certified pool operator, as well as all certifications for lifeguard. Very knowledgeable. We have signed agreements with their healthcare consultants. The health supervisor is the camp director who's on staff all the time. Again, all the certifications that she needs. All the medication storage units were all looked at. Everything looked fine. Everything is locked up. All their logs are in place. Just so you know, all this is in the Rocky Knoll Lodge. It's all in that one building that they're using. They have a separate room that has all the files, all the medications, things like that in there. First aid kits and so forth. All the immunization records were gone through for staff and the campers. They have a really great system of tracking. They have like a color-coded system where they, as people submit their paperwork, they go from one color to the next, and until they reach that final color, the children aren't allowed. So they have to, once it's complete, so they're very, very organized and about making sure everyone is.
The quarries and the stories.
Yeah, that's all part of this color-coded scheme where they have everything very detailed. I mean, it was very impressive the way they do it. So there's no, I mean, any mistake can happen, but the chance is pretty slim the way they do it. It's really done well. We talked about the swimming pool. They do swim tests for all the kids that come in. First thing they do, and they give them bracelets according to their abilities. Let's see, all the equipment is in good repair, no problems there. They're not doing any like firearms, any practice like that. They're not doing any of that. Archery they're not doing right now, but they may in the future. They just haven't got there yet. But the Girl Scouts used to have an archery station, so they would like to include that. But again, they just haven't got there yet. Hoping probably next year. No horseback riding yet, but that's something they're also looking into down the road, but nothing yet. Let's see. Yeah, we talked about the building inspector and the fire chief did inspect everything to make sure that it's up to their standards, and they signed off. They're not using any of the outdoor tents right now. They're not sure when they'll get to that, but they will at some point. All the restrooms have been updated, all new
Oh, nice.
accessories have been put in. The water's been tested. Another good thing is they do have a no smoking policy, so which is good.
Fine, Frank.
Let's see. Right now, they're not going to have any food service there. In the future, they may. Right now, the Brookside Lodge, which is the lodge they're not using right now, does have a nice setup where they could have a kitchen in there. But right now, they're just having kids bring their lunches, not preparing any food.
Better.
They have a plan if you know a child forgets their lunch, they have a plan with local restaurants to get them food. But basically, they're asking them to bring non-perishable items. If someone does bring in one, they do have a refrigerator there that they can store it in, but they're really urging them not to bring anything that's perishable. But again, they might look at that in the future as, you know, providing food at some of the events. They also have a ropes course there and a rock climbing course. And you can see on this map here, where it has Raleigh campus, you can see where those courses are. But anyway, they were inspected. They were inspected on June 26th, and they were all satisfactory and safe to use. And we have a copy of that in our file as well. And also in your packet, you'll see, if you were curious about an idea what they do at the camps, there's a page in there that has a weekly schedule that sort of gives you a breakdown of the types of activities they do, from swimming to you know, survival skills, you know,
I think
science.
the price is pretty good,
Yeah, yeah.
not exorbitant.
Mm-hmm. So anyway, that's a little.
Well, I think we have a good understanding.
Yep. Any
Excellent.
questions on the camp?
Nope.
No.
Okay.
And what is their rent? Are they paying $1?
Yeah. Yeah. They
No good deal.
Yes.
they have invested quite a bit in sprucing up some of the buildings. And again, I think it goes back to whether their 3-year lease will get renewed. So we'll have to keep talking about that. But they have, you know, they have a lot of plans for future use
Yeah,
here.
it's-
They're really going to
it's-
expand it quite a bit.
Lovely property, but
Yeah.
it should be used.
It is, and they're trying to use it, you know, max their use. Now, as far as the access to the conservation land, I think we had talked about this at the last meeting. You have this map in your packet, right?
Yeah.
Basically, there's going to be 2 entrances. One's going to be that main entrance where the Girl Scouts use to go to the camp area. Now, a little further down the road, where there's that bend in the road, you see it when you follow Weathersfield Street down, and you get to where it has that sharp turn there. There's going to be an entrance there. They're proposing some parking. Do you have this in your packet? Do you have a copy of this? The Selectmen and the Conservation Commission are working on developing a little area where some cars can park in this area, and
And how's that has to do with Board of Health?
Well, it does, and it's basically just a way to get to that, to the conservation land in the back. So, when you look at your map, when you park in this corner here, there's gonna be some parking there. They're really encouraging people to enter from the Arias Park side of things. But if you did wanna access from the Weathersfield Street side, there's gonna be a little parking area there, and basically there's gonna be a trail that walks alongside of the camping area, and then eventually gets to this conservation land, which, as you can see, the Smith Lane that runs all the way through Arias Park. So you really won't be able to go into the camping area where the children are. You'll be kind of walking along the side of it to get to that land in the back, unless you come in from the other side through Arias Park.
Okay,
All right.
thank you.
Yep, but there, like I said, there will be signs posted on each entrance so people know where to go. I believe that's about it as far as the former Girl Scout property. Any questions on anything?
No, definitely.
No? Okay. All right. Next, last thing, if you'd like to.
I'm not really prepared to talk about these
Yeah.
proposed regulations.
Right, yeah, no, we weren't gonna really get too much
Yeah.
into it. It was more, basically we wanted to, we had talked before about updating some of our local regulations. And the first two that came to mind were the well regulations and our local Title V regulations.
Right.
In your packet that you have, I think Susan, and I don't know if you have it with you tonight, Charlie, but if you don't, that's okay.
Oh,
Yeah, the packet I left.
yeah,
For-
I didn't bring it with me.
That's okay, you don't need it tonight, but basically, we're looking to sort of clean those up and get them updated a little bit. In your packet, you'll see the existing regulations that are in place right now. The way they are now, the well and the Title V are sort of in one. They're Part 1 and Part 2, Part 1 being the Title V, and then Part 2 has the private water supply. We were thinking if the board wanted to, was separating them out, having them sort of
Yeah,
stand
makes
alone.
sense.
Because I don't know why they were combined to begin with, I'm not
Yep.
really sure, but,
What does the state do?
the state, well,
They're separate.
yeah,
They're
there's,
separate with the state, well, we should follow them.
yeah, what we did, we took the model regulations for private well from the state, and in your packet, you're gonna see, they're pretty lengthy, so we wanted to trim them down a little bit because we're trying to keep it focused and to the point without a lot of extra repetitive things in there. So in your packet, you'll see the model regulations from the state that has a lot of highlighting in there that we thought.
And you've already given me that.
Yes, you have that, yeah. Those are, all the highlighted items were things that we thought could be taken out.
So why don't people look that over and at our next meeting,
Yeah.
talk about this?
Yes, exactly. What we're hoping was to have you look at it, make notes in it,
Okay.
so we could, and maybe get them back to us, so we could incorporate them into a draft for you to look at.
Yep.
But like, as you can see, there's quite a bit that we, highlighted to remove, because it was a little bit too lengthy, we thought. But unless you feel that you want all that in there, that's.
So
that's
the
what
highlighted is what you want removed.
we're proposing. So,
Right.
yeah.
Right.
There's also a proposed
Just
draft.
a good job.
Yeah, Wendy did a lot of work on, you guys, you can see the proposed draft ones that are color-coded. There's the red, what basically the proposed is that the condensed, shortened version of the state guidelines. Yeah, so basically condense that down, and you'll see that there's a proposed draft in there that has, the red writing is what we're thinking of removing or had questions on that we wanted the board to think about. The blue writing is things that we're thinking of adding in that the state didn't have, that we thought were important, if you thought it was important. They're basically common sense things that is not really more regulations, just more common sense things. I'm not really sure why
Mhm.
they weren't talked about in there, but we thought you might want to put them in there. And
have you looked at surrounding communities
we
also?
have, yeah, we have, like I said, Wendy did a lot of research on the different
I think
communities.
Wendy did a really good job on
Yeah,
that.
she did.
Yeah.
She put, she, again, highlighted the different colors so you
Yeah.
could compare the two.
Good job.
There were some that were really above and beyond what the state had, that were really out there, yeah, restrictive. And the others that were worse than our current ones. So we tried to find some that were in the middle, but then we found that it was easier just to kind of go with the state and use our own way of trimming down.
Okay,
But like I said, you see, they're all color coded, and if you could make notes in those and give them back, because you may say, well, we don't want this in there, or we want, you know, we want this many feet, not this many feet.
great. While we're on that topic, why don't we set a meeting date for our next meeting? How does August 24th sound, or the 17th?
Either one's good.
I think either one's good.
Which one would we,
We can.
well, let's set it
Oh,
now
we'll
so
set
we
it,
can
okay.
plan around it. Shall we do, let's do the 24th.
Okay.
Be feeling kind of fallish.
Yeah, if there's something that, you know.
We can
comes
turn
up
down the
before
air
that-
conditioning.
If there's something that comes up before that, we can certainly let you know, but.
Yeah, so the 24th is tentatively,
Yeah,
Tentative.
I may be away, but I don't know.
Okay.
well,
And we can,
I'll
We-
make sure that I'm at home.
we can change,
yeah,
we can change the
we
dates.
can look at it again, sure, absolutely. Okay. And actually, in your packet also, when you had sort of done the same thing on the local Title V regulations, you'll see the same colored highlighting. That's the other one that we talked about looking at. There's a lot of duplication in there that's already in Title V. But anyway, you can go through that and see what you think of that. Again, the same color coding system. But, you know, you can do them separately, you can do them together, you can do them any way you like.
All right. Well, next up, I guess, is the minutes.
Yes.
Right.
These would be the minutes for our May 11th meeting.
Very good.
Excuse me, whenever you're ready to make a motion on these minutes.
John Melcher, I move to accept the May 11th minutes.
I second that.
All those in favor?
Right?
Aye. You wanna
Okay.
sign these?
Yes, it's sign your copy. Well, we have some bookkeeping to do.
Yep.
Oh, that's... Two?
Just two.
Oh, that's good.
I'm tired.
What, you sailing today?
No, I was fly fishing.
Are you exhausted?
I like semi-retirement.
I'm just babysitting.
Oh,
Oh, that's pretty nice, John.
Well, it depends. Actually, I didn't do the heavy lifting.
how could I guess?
Oh, why did I do that?
Exactly.
Sorry, John. I should be on the bottom line.
Why?
I just re-upped.
Oh, you just,
Oh.
congratulations on your
Yes, I went down
reappointment.
to the town hall and I swore.
The latest one to re-up
Congratulations.
becomes, is when we reorganize at our next meeting, you're the new chairman.
Is that right?
Yes.
That was our new policy.
I look
We
forward to it,
Nice.
too.
passed.
I'm a retirement age, you know.
I,
We all are.
I'm telling you, I trump all both of you guys.
Charlie's the
You, but
baby
you know
here.
what, you should maybe stop using that word. Trump.
Yeah, I know. That's a scary word.
That should be out of the
I
dictionary.
know.
Removed from the lexicon.
Yeah. Okay, well, thank you for filming us.
Yeah,
So that,
we've
We to
closed.
adjourn.
We've adjourned. I know you're enjoying it.
Congratulations on staying awake.